Question 1. The audit findings indicate a recurring pattern of delayed recognition and inconsistent management of intraoperative hypotensive events in the anesthesia department. Specifically, the audit highlighted instances where significant drops in blood pressure were not immediately addressed with targeted interventions, leading to prolonged periods of hypoperfusion. Based on the VTS anesthesia and analgesia scope of practice and established veterinary anesthesia guidelines, which of the following represents the most appropriate immediate response for a VTS encountering a patient experiencing sudden, severe hypotension during a surgical procedure? Option A. Administer a broad-spectrum analgesic to alleviate any potential pain contributing to the hypotension, and then reevaluate vital signs in 5 minutes. Option B. Immediately initiate intravenous fluid boluses and administer a vasopressor, while simultaneously assessing the patient for other concurrent abnormalities and communicating findings to the supervising veterinarian. Option C. Continue monitoring the patient closely and wait for the supervising veterinarian to identify the hypotension and direct specific treatment. Option D. Increase the concentration of inhalant anesthetic to provide deeper anesthesia, assuming the hypotension is a direct result of anesthetic depth. The correct answer is B. Immediately initiate intravenous fluid boluses and administer a vasopressor, while simultaneously assessing the patient for other concurrent abnormalities and communicating findings to the supervising veterinarian. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate, accurate recognition of a life-threatening cardiovascular emergency in a patient undergoing anesthesia. Complexity arises from the subtle and often overlapping signs of cardiovascular compromise, the need to differentiate between anesthetic side effects and true emergencies, and the critical time window for intervention. The veterinary technician specialist, VTS, in anesthesia and analgesia must possess advanced knowledge of cardiovascular physiology, pharmacology, and emergency protocols, coupled with the ability to remain calm and decisive under pressure. The audit findings highlight a systemic issue in the clinic's preparedness and response, underscoring the importance of standardized protocols and ongoing training. Correct approach analysis. The correct approach involves a systematic, evidence-based response that prioritizes patient safety and adheres to established veterinary anesthesia guidelines. This includes immediate assessment of vital signs, prompt identification of the specific cardiovascular emergency, e.g., hypotension, bradycardia, or arrhythmias, and the initiation of appropriate, targeted interventions based on the suspected cause. This approach aligns with the ethical obligations of veterinary professionals to provide competent care and the regulatory framework that mandates adherence to best practices in patient management. Specifically, it reflects the VTS's role in advanced patient monitoring and emergency management, as outlined by credentialing bodies that define the scope of practice for VTS. The emphasis on a structured, protocol-driven response minimizes the risk of delayed or inappropriate treatment, which could have severe consequences. Incorrect approaches analysis. One incorrect approach involves delaying intervention while attempting to reconfirm the diagnosis through less immediate diagnostic methods. This failure to act swiftly in a cardiovascular emergency constitutes a breach of the duty of care. Ethically, it prioritizes diagnostic certainty over immediate patient well-being, which is unacceptable when a life-threatening condition is suspected. Regulatory frameworks for veterinary practice emphasize prompt and appropriate intervention in emergencies. Another incorrect approach is to administer broad-spectrum emergency drugs without a clear diagnostic hypothesis or a targeted treatment plan. This shotgun approach can lead to iatrogenic complications, mask the underlying problem, or be ineffective. It demonstrates a lack of critical thinking and a failure to apply specialized knowledge, which is contrary to the expectations of a VTS. Such actions could be considered negligent under Veterinary Practice Acts. A third incorrect approach is to rely solely on the supervising veterinarian's direction, without actively contributing to the diagnostic and treatment process, especially when the VTS possesses advanced expertise in anesthesia and critical care. While the veterinarian has ultimate responsibility, the VTS is expected to be a proactive member of the team, offering informed suggestions and executing advanced interventions. A passive role in a critical situation can be seen as a failure to uphold the responsibilities associated with VTS certification, and could be a regulatory concern regarding the scope of practice and team collaboration. Professional reasoning. When faced with a potential cardiovascular emergency, the professional decision-making process should follow a structured approach. 1. Recognize the abnormal, continuously monitor patient parameters and identify deviations from the expected norm. 2. Assess the severity. Determine the urgency of the situation based on the magnitude of the deviation and the patient's overall condition. 3. Formulate a differential diagnosis. Consider the most likely causes of the observed abnormalities, drawing upon knowledge of anesthetic drugs, patient factors, and surgical procedures. 4. Prioritize interventions. Based on the differential diagnosis, select the most appropriate and immediate interventions. 5. Implement and monitor. Administer treatments and closely observe the patient's response, adjusting the plan as needed. 6. Communicate effectively. Maintain clear and concise communication with the veterinary team, documenting all findings and actions. This systematic approach ensures that patient care is evidence-based, efficient, and aligned with professional standards and regulatory requirements. Question 2. Which approach would be most appropriate for a veterinary technician specialist in anesthesia and analgesia to manage a patient exhibiting pupillary dilation during a routine surgical procedure under general anesthesia? Option A. Administer a reversal agent to assess patient responsiveness. Option B. Assess other vital signs and physical reflexes to determine overall anesthetic depth before making any adjustments. Option C. Increase the rate of intravenous fluid administration to improve tissue perfusion. Option D. Immediately deepen the anesthetic plane based on the pupillary dilation. Correct answer is D. Immediately deepen the anesthetic plane based on the pupillary dilation. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary anesthesia, distinguishing between normal physiological responses and signs of inadequate anesthetic depth or impending crisis. The anesthetist must rapidly assess multiple patient parameters to ensure patient safety and efficacy of the anesthetic protocol. Failure to accurately interpret these signs can lead to awareness, prolonged recovery, or severe adverse events. Correct approach analysis. The correct approach involves a systematic evaluation of multiple patient indicators, prioritizing those that most directly reflect anesthetic depth and cardiovascular stability. This aligns with best professional practice as outlined by veterinary anesthesia guidelines, emphasizing a holistic patient assessment rather than relying on a single parameter. This approach ensures that the anesthetist is not misled by isolated findings and can make informed adjustments to the anesthetic plan, thereby upholding the ethical obligation to provide competent and safe patient care. Incorrect approaches analysis. Relying solely on a single parameter, such as pupil dilation, to assess anesthetic depth is a significant regulatory and ethical failure. Veterinary anesthesia guidelines and ethical codes mandate a comprehensive assessment. Pupil dilation can be influenced by factors other than anesthetic depth, such as anticholinergic drugs or surgical manipulation. Similarly, assuming adequate depth based solely on a stable heart rate, without considering other indicators like blood pressure, respiratory rate, and muscle tone is insufficient and potentially dangerous. This overlooks the interconnectedness of physiological systems under anesthesia and can lead to critical misjudgments. Focusing only on the surgical site without integrating systemic patient data is also a failure to provide holistic care, as systemic stability directly impacts the surgical field and patient outcome. Professional reasoning. Professionals should employ a structured decision-making framework that involves continuous monitoring and interpretation of a multimodal dataset. This includes 1. Establishing a baseline of normal physiological parameters for the species and patient. 2. Continuously observing and recording vital signs, heart rate, rhythm, blood pressure, respiratory rate, SpO2, echo2 temperature. 3. Assessing physical signs of anesthetic depth, palpebral reflex, corneal reflex, jaw tone, nystagmus movement. 4. Integrating all data points to form a comprehensive picture of the patient's anesthetic status. 5. Making timely and appropriate adjustments to the anesthetic plan based on this integrated assessment. Question 3. The review process indicates a need to refine the approach to anesthetic risk assessment for a patient presenting with a complex cardiac condition requiring emergent surgery. Which of the following represents the most appropriate and ethically sound methodology for the veterinary technician specialist to employ in this situation? Option A. Prioritize anesthetic agents that facilitate the quickest possible induction and recovery, assuming this will minimize the overall anesthetic time and associated risks. Option B. Defer the primary anesthetic risk assessment to the surgeon, focusing solely on preparing the anesthetic equipment as directed. Option C. Proceed with a standard anesthetic protocol for the surgical procedure, without extensive investigation into the patient's specific cardiac comorbidities, as the surgery is considered emergent. Option D. Conduct a thorough pre-anesthetic evaluation, meticulously documenting the patient's cardiac status, identifying specific risk factors, and selecting anesthetic agents and techniques that are known to have minimal cardiovascular depressant effects and allow for robust physiological monitoring. The correct answer is D. Conduct a thorough pre-anesthetic evaluation, meticulously documenting the patient's cardiac status, identifying specific risk factors, and selecting anesthetic agents and techniques that are known to have minimal cardiovascular depressant effects and allow for robust physiological monitoring. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to balance the immediate need for surgical intervention with the inherent risks associated with anesthetic agents, particularly in a compromised patient. The decision-making process must be grounded in a thorough risk assessment that considers the patient's specific condition, the chosen anesthetic agents, and potential adverse outcomes. Failure to adequately assess and mitigate risks can lead to patient harm, which has significant ethical and professional repercussions. Correct approach analysis. The correct approach involves a comprehensive pre-anesthetic assessment that prioritizes identifying and quantifying patient-specific risk factors. This includes a detailed review of the patient's history, physical examination findings, and diagnostic test results. Based on this assessment, the technician specialist must select anesthetic agents and techniques that minimize physiological stress and maximize patient safety, considering the patient's age, comorbidities, and the nature of the surgical procedure. This aligns with the ethical obligation to provide the highest standard of care and the regulatory expectation to practice within the scope of veterinary technician specialization, which includes advanced anesthetic risk assessment and management. Incorrect approaches analysis. An approach that solely relies on the surgeon's preference without independent risk assessment by the technician specialist is ethically and professionally deficient. It abdicates the technician's responsibility to advocate for patient safety and can lead to the use of inappropriate anesthetic protocols for the patient's condition. This failure to exercise independent professional judgment violates the core principles of patient care and the VTS role. An approach that prioritizes speed of induction and recovery over patient stability and physiological monitoring is unacceptable. While efficiency is important, it must never compromise patient safety. Anesthetic agents and techniques should be chosen to provide smooth induction and recovery with minimal cardiovascular and respiratory compromise, supported by vigilant monitoring. This approach demonstrates a disregard for the fundamental principles of anesthetic safety and patient well-being. An approach that neglects to consider the potential for adverse drug interactions, contraindications based on the patient's current medications or underlying conditions, is a significant ethical and professional failing. A thorough risk assessment must encompass all aspects of the patient's health and current therapeutic regimen to prevent iatrogenic harm. This oversight can lead to severe complications and is a direct violation of the duty of care. Professional reasoning. Professionals should approach anesthetic risk assessment by systematically evaluating patient factors, procedure factors, and drug factors. This involves a multifaceted approach that includes a thorough patient history, physical examination, review of diagnostic data, and consideration of the proposed surgical intervention. The technician specialist must then critically evaluate available anesthetic agents and techniques, selecting those that offer the best risk-benefit profile for the individual patient. Continuous reassessment and adaptation of the anesthetic plan based on real-time patient response are paramount. This systematic and patient-centered approach ensures that care is delivered in accordance with established professional standards and ethical obligations. Question 4. The analysis reveals that a veterinary technician specialist, VTS, in anesthesia and analgesia is preparing to anesthetize a canine patient for a routine ovariohysterectomy. The VTS has access to the patient's medical record, which includes a history of mild mitral valve insufficiency, considering the VTS's role in developing and implementing anesthetic plans. Which of the following approaches best reflects best professional practice in this scenario? Option A. Proceed with a modified anesthetic protocol that includes pre-anesthetic assessment of cardiovascular function, selection of cardiovascularly stable anesthetic agents, and close monitoring of blood pressure and cardiac rhythm throughout the procedure. Option B. Rely on the surgeon's assessment of the patient's cardiovascular status during the procedure to guide anesthetic adjustments, as the surgeon is ultimately responsible for the patient's outcome. Option C. Administer a standard anesthetic protocol for healthy canines undergoing ovariohysterectomy, as the mitral valve insufficiency is mild and unlikely to significantly impact anesthetic management. Option D. Utilize a generic anesthetic protocol found in a widely circulated veterinary textbook, assuming it covers most common scenarios and can be applied universally to minimize preparation time. The correct answer is C. Administer a standard anesthetic protocol for healthy canines undergoing ovariohysterectomy, as the mitral valve insufficiency is mild and unlikely to significantly impact anesthetic management. Explanation: this scenario presents a professional challenge due to the inherent variability in patient response to anesthetic agents and the critical need for continuous patient monitoring to ensure safety and efficacy. The veterinary technician specialist, VTS, in anesthesia and analgesia must possess a comprehensive understanding of anesthetic principles and their application across diverse patient populations and surgical procedures. This requires not only theoretical knowledge, but also the ability to adapt protocols based on real-time patient data and anticipate potential complications. The correct approach represents best professional practice because it prioritizes patient safety and well-being through a systematic and evidence-based methodology. This aligns with the core ethical obligations of veterinary professionals to provide competent care and minimize patient suffering. Specifically, it reflects the VTS's role in developing, implementing, and refining anesthetic plans, which necessitates a thorough pre-anesthetic assessment, selection of appropriate agents and techniques, meticulous monitoring, and proactive management of any deviations from the expected anesthetic course. This approach is supported by the overarching principles of Veterinary Practice Acts and professional conduct guidelines that mandate a high standard of care. An incorrect approach that relies solely on historical data without considering individual patient factors fails to meet the standard of care. This is a regulatory and ethical failure because it demonstrates a lack of individualized patient assessment and can lead to suboptimal anesthetic outcomes or adverse events. It neglects the dynamic nature of anesthesia and the responsibility to tailor care to the specific needs of each patient. Another incorrect approach that prioritizes speed over thoroughness in pre-anesthetic assessment is also professionally unacceptable. This constitutes a regulatory and ethical failure as it compromises the foundation upon which a safe anesthetic plan is built. A rushed assessment increases the risk of overlooking critical patient information that could influence anesthetic drug choices, dosages, or monitoring parameters, thereby jeopardizing patient safety. A third incorrect approach that involves deviating from established protocols without a clear, justifiable rationale based on patient status is a significant regulatory and ethical lapse. This demonstrates a lack of understanding of the scientific basis for anesthetic protocols and a failure to adhere to best practices. It can lead to unpredictable patient responses and an increased risk of complications, violating the duty to provide competent and safe anesthesia. The professional decision-making process for similar situations involves a structured approach. 1. Comprehensive patient assessment. Thoroughly evaluate the patient's signalment, history, physical examination findings, and diagnostic results to identify any pre-existing conditions or risk factors. 2. Anesthetic plan development. Based on the assessment, formulate a tailored anesthetic plan, selecting appropriate agents, routes of administration, and monitoring strategies. This plan should be flexible and adaptable. 3. Meticulous monitoring. Continuously monitor vital signs and anesthetic depth using appropriate equipment and techniques, interpreting the data in the context of the individual patient. 4. Proactive problem solving. Anticipate potential complications and have contingency plans in place. Respond promptly and effectively to any deviations from the expected anesthetic course, adjusting the plan as necessary. 5. Documentation. Accurately record all assessments, interventions, and patient responses. Question 5. Strategic planning requires a veterinary technician specialist in anesthesia and analgesia to meticulously evaluate a canine patient presenting for an emergency ovariohysterectomy due to pyometra. The patient is lethargic, mildly dehydrated, and has a palpable abdominal discomfort. The supervising veterinarian has indicated the surgery is urgent. Which of the following approaches best exemplifies the VTS's role in optimizing pre-anesthetic assessment for this high-risk patient? Option A. Rely solely on the patient's previous anesthetic records from 2 years prior, assuming the patient's condition has not significantly changed since that time. Option B. Delegate the entire pre-anesthetic assessment to a junior veterinary assistant, instructing them to obtain basic vital signs and report back to the veterinarian. Option C. Conduct a thorough physical examination, including auscultation of the heart and lungs, assessment of mucous membrane color and capillary refill time, palpation for abdominal pain, and review of any available diagnostic results before formulating a preliminary anesthetic plan. Option D. Proceed directly to anesthetic induction after a brief verbal confirmation of the patient's presenting complaint and the veterinarian's urgency, relying on the veterinarian's assessment for overall risk. Correct answer is D. Proceed directly to anesthetic induction after a brief verbal confirmation of the patient's presenting complaint and the veterinarian's urgency, relying on the veterinarian's assessment for overall risk. Explanation. This scenario is professionally challenging because the veterinary technician specialist, VTS, in anesthesia and analgesia must balance the immediate need for surgical intervention with the patient's underlying systemic instability. A thorough pre-anesthetic assessment is not merely a procedural step, but a critical diagnostic and risk stratification process. The VTS's responsibility extends beyond administering anesthetic agents to ensuring patient safety throughout the perianesthetic period, which is directly governed by the ethical principles and practice standards expected of a VTS. The correct approach represents best professional practice because it prioritizes patient safety by systematically gathering comprehensive data, interpreting it in the context of the patient's condition, and formulating a tailored anesthetic plan. This aligns with the core tenets of veterinary medicine, emphasizing the veterinarian's duty of care and the technician's role in supporting that care through skilled assessment and intervention. Specifically, it adheres to the principles of responsible veterinary practice, which mandate a thorough evaluation before any procedure that carries inherent risks, such as anesthesia. This proactive approach minimizes anesthetic complications and improves patient outcomes, fulfilling the VTS's commitment to excellence in their specialty. An incorrect approach that solely focuses on the immediate surgical need without a comprehensive pre-anesthetic assessment fails to uphold the standard of care. This oversight can lead to the masking of critical underlying conditions, such as subclinical cardiac or respiratory disease, which could be exacerbated by anesthetic induction and maintenance. Such a failure constitutes a breach of professional responsibility and potentially violates practice acts or guidelines that require appropriate patient evaluation prior to invasive procedures. Another incorrect approach that relies solely on historical data without current physical examination is also professionally unacceptable. While past medical history is valuable, a patient's condition can change rapidly. Ignoring current vital signs, physical findings, and laboratory results from the present day introduces significant risk. This disregard for current patient status represents a failure to apply critical thinking and a deviation from established protocols for safe anesthetic management, potentially leading to adverse events and compromising patient welfare. A further incorrect approach that delegates the entire pre-anesthetic assessment to a less experienced technician without direct VTS oversight is also problematic. While teamwork is essential, the VTS, by virtue of their advanced training and specialization, is uniquely qualified to interpret complex findings and develop nuanced anesthetic plans. Delegating this critical phase without appropriate supervision can lead to missed critical information or misinterpretation of findings, ultimately jeopardizing patient safety and falling short of the expected standard of care for a VTS. The professional decision-making process for similar situations should involve a systematic, multifaceted approach. First, a comprehensive review of the patient's history and the reason for the procedure is essential. Second, a thorough physical examination, including detailed cardiovascular and respiratory assessments, should be performed. Third, relevant diagnostic tests, e.g., blood work, thoracic radiographs, should be considered and interpreted in light of the physical findings and patient history. Fourth, all gathered information must be synthesized to identify potential anesthetic risks and develop a specific, individualized anesthetic plan that addresses these risks. Finally, clear communication with the supervising veterinarian regarding the assessment and proposed plan is paramount. Question 6. The monitoring system demonstrates stable vital signs during induction with isoflurane, and the veterinarian has requested a switch to sevoflurane for maintenance anesthesia due to its faster wash-in and wash-out properties, which are beneficial for the planned short procedure. However, the clinic's inventory shows that sevoflurane is significantly more expensive than isoflurane, and the client had previously expressed concerns about the cost of the procedure. As a veterinary technician specialist in anesthesia and analgesia, what is the most ethically and professionally appropriate course of action? Option A. Inform the client that sevoflurane is more expensive and suggest they approve the use of isoflurane instead, without fully explaining the anesthetic advantages of sevoflurane for this specific procedure. Option B. Proceed with the switch to sevoflurane as directed by the veterinarian, assuming the veterinarian has already considered the client's financial situation and determined it to be the best anesthetic choice for the patient's safety and the procedure's efficiency. Option C. Immediately inform the veterinarian of the client's prior cost concerns and request a discussion with the client about the rationale for switching to sevoflurane, outlining potential benefits and the associated cost increase to obtain their informed consent before proceeding. Option D. Continue with isoflurane for the duration of the procedure, as it is already providing stable anesthesia and is the less expensive option, thus adhering to the client's implied preference for cost-effectiveness. The correct answer is C. Immediately inform the veterinarian of the client's prior cost concerns and request a discussion with the client about the rationale for switching to sevoflurane, outlining potential benefits and the associated cost increase, to obtain their informed consent before proceeding. Explanation. This scenario presents a professional challenge because it requires the veterinary technician specialist to balance immediate patient needs with the ethical imperative of informed consent and client communication, all within the established regulatory framework for veterinary practice. The core of the dilemma lies in the potential for a less expensive anesthetic to compromise patient safety or recovery, which could have significant financial implications for the client and ethical implications for the veterinary team. The correct approach represents best professional practice because it prioritizes patient welfare and client autonomy by clearly explaining the risks and benefits of each inhalant anesthetic, including the potential for prolonged recovery or adverse effects associated with a less expensive option. The technician empowers the client to make an informed decision. This aligns with ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as the professional responsibility to maintain transparency with clients. Adhering to the regulatory framework, which often mandates clear communication and client consent for procedures and treatments, is paramount. An incorrect approach that involves unilaterally choosing the less expensive anesthetic without full client consultation and informed consent would represent a significant ethical and regulatory failure. This could be construed as practicing without full disclosure, potentially leading to a breach of trust with the client and violating professional standards that emphasize shared decision-making. Furthermore, if the chosen anesthetic leads to adverse outcomes, the veterinary practice could face liability issues. Another incorrect approach, such as downplaying the risks of the less expensive option to encourage its selection, constitutes misrepresentation and undermines the client's ability to make a truly informed choice, violating principles of honesty and transparency. The professional decision-making process for similar situations should involve a systematic evaluation of patient needs, available anesthetic options, their associated risks and benefits, and the client's financial constraints and preferences. This includes open and honest communication, providing clear explanations in understandable terms, documenting the discussion and the client's decision, and always prioritizing patient safety as the ultimate guiding principle. Question 7. During the evaluation of a canine patient anesthetized for orthopedic surgery, the VTS notes a sudden and significant drop in blood pressure, with systolic pressure falling to 70 mmHg and mean arterial pressure to 50 mmHg. The patient is receiving isoflurane at 2.5% in oxygen, is mechanically ventilated and has a heart rate of 140 bpm. The VTS has just administered a bolus of intravenous fluids. Which of the following is the most appropriate immediate next step? Option A. Administer a bolus of a neuromuscular blocking agent to reduce metabolic demand. Option B. Immediately discontinue all anesthetic agents and prepare for recovery. Option C. Decrease the concentration of isoflurane and administer a small bolus of a vasopressor. Option D. Increase the concentration of isoflurane to improve cardiovascular stability. The correct answer is C. Decrease the concentration of isoflurane and administer a small bolus of a vasopressor. Explanation. This scenario presents a common challenge in veterinary anesthesia where a patient's physiological status deviates from expected norms, requiring the veterinary technician specialist, VTS, to make critical decisions under pressure. The challenge lies in accurately interpreting the presented data, understanding the underlying pathophysiology, and selecting the most appropriate intervention to ensure patient safety and anesthetic efficacy, all while adhering to established protocols and ethical standards. The VTS must balance immediate patient needs with the long-term implications of their actions. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based response to a critical patient event. It involves a thorough assessment of the patient's current state, consideration of potential causes for the observed changes, and the selection of an intervention that directly addresses the most likely etiology while minimizing iatrogenic risk. This aligns with the VTS role in monitoring, intervening, and communicating effectively with the supervising veterinarian. Ensuring patient welfare is paramount. Adherence to established anesthetic protocols and the VTS's advanced knowledge base are crucial for this decision-making process. An incorrect approach that involves solely increasing the anesthetic depth without further assessment fails to address the root cause of the hypotension. This could exacerbate the problem if the hypotension is due to hypovolemia or vasodilation, leading to further cardiovascular compromise. This approach demonstrates a lack of critical thinking and a failure to apply advanced monitoring and diagnostic skills expected of a VTS. It may also violate ethical principles of providing competent care and acting in the best interest of the animal. Another incorrect approach, such as immediately discontinuing all anesthetic agents, could lead to a sudden and dangerous return of consciousness and pain perception, potentially causing significant patient distress and physiological instability. This reactive measure, without a clear understanding of the cause or a plan for smooth recovery, is not a controlled or professional response. It disregards the need for a gradual and safe transition from anesthesia to recovery and could be considered a failure to provide appropriate patient management. The professional reasoning framework for this situation involves a cyclical process of assessment, diagnosis, intervention, and reassessment. The VTS should first recognize the deviation from normal parameters, then gather further data e.g., palpate pulses, assess mucous membrane color, check for bleeding, evaluate ventilation, formulate a differential diagnosis for the hypotension, select the most appropriate intervention based on the likely cause and patient status, administer the intervention, and then continuously reassess the patient's response to ensure the intervention is effective and no new problems have arisen. Effective communication with the supervising veterinarian at critical junctures is also a vital component of this framework. Question 8. Governance review demonstrates a need to refine protocols for managing intraoperative cardiovascular and respiratory instability. During a routine ovariohysterectomy under general anesthesia, a veterinary technician specialist observes a gradual decrease in systolic blood pressure from 120 mmHg to 90 mmHg, accompanied by a concurrent increase in heart rate from 90 bpm to 110 bpm, and a slight decrease in respiratory rate from 20 breaths per minute to 16 breaths per minute. The patient is receiving isoflurane and is on mechanical ventilation. Which of the following represents the most appropriate immediate course of action for the veterinary technician specialist? Option A. Continue monitoring without intervention as these changes are within acceptable anesthetic depth variations. Option B. Increase the concentration of isoflurane to deepen anesthesia and stabilize the blood pressure. Option C. Administer a bolus of intravenous crystalloid fluid and decrease the isoflurane concentration. Option D. Administer a vasopressor immediately to counteract the hypotension. The correct answer is B. Increase the concentration of isoflurane to deepen anesthesia and stabilize the blood pressure. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in veterinary anesthesia, interpreting and responding to subtle but significant changes in vital signs during a procedure. The professional challenge lies in distinguishing between normal physiological fluctuations and indicators of developing complications, requiring a nuanced understanding of anesthetic depth, patient status, and potential underlying issues. The pressure to maintain patient safety while ensuring surgical progress necessitates rapid, accurate assessment and decisive action. Correct approach analysis. The correct approach prioritizes a systematic, multifaceted assessment that considers the interconnectedness of vital signs and their implications for anesthetic management. This aligns with best professional practice by emphasizing a holistic view of the patient's physiological state. Specifically, it involves correlating the observed heart rate and respiratory rate with blood pressure trends, considering the anesthetic agents being used, the patient's underlying condition, and the stage of the procedure. This comprehensive evaluation allows for the identification of the most probable cause of the observed changes and the implementation of targeted interventions, thereby upholding the ethical obligation to provide competent and compassionate care as mandated by veterinary practice acts and professional guidelines. Incorrect approaches analysis. One incorrect approach involves solely focusing on a single vital sign in isolation. For instance, reacting solely to a slightly elevated heart rate without considering the respiratory rate, blood pressure, or anesthetic depth could lead to unnecessary interventions or masking of a more serious problem. This fails to meet the standard of care by neglecting a comprehensive patient assessment, potentially violating ethical principles of diligence and competence. Another incorrect approach is to delay intervention until vital signs reach extreme, overtly critical levels. This reactive strategy, rather than a proactive one, can allow a developing crisis to escalate, increasing patient risk. Such a delay could be considered a failure to act in the best interest of the patient, potentially contravening professional conduct standards that require timely and appropriate responses to patient distress. A third incorrect approach might be to attribute all vital sign changes to the anesthetic agents alone, without considering other potential contributing factors such as pain, hypothermia, or surgical manipulation. This oversimplification can lead to misdiagnosis and inappropriate treatment, demonstrating a lack of thorough diagnostic reasoning and potentially falling short of the expected standard of care. Professional reasoning. Professionals should employ a decision-making framework that begins with continuous monitoring of all relevant vital signs. Upon observing deviations, the next step is to contextualize these changes by considering the patient's signalment, pre-existing conditions, anesthetic agents and dosages, surgical procedure, and environmental factors. This leads to the formulation of differential diagnoses for the observed abnormalities. Based on the most likely diagnosis, a targeted intervention is implemented, followed by reassessment to evaluate the efficacy of the intervention. This iterative process of monitoring, assessment, intervention, and reassessment is crucial for safe and effective anesthetic management. Question 9. Market research demonstrates a growing demand for advanced pain management protocols in veterinary surgical settings. A veterinary technician specialist in anesthesia and analgesia is tasked with developing a comprehensive understanding of opioid classes to optimize patient care. Considering the primary receptor targets and resulting pharmacological effects, which of the following classifications accurately distinguishes the major opioid categories used in veterinary anesthesia and analgesia? Option A. Opioids are classified as inhalant, injectable, and oral based on their primary route of administration, which determines their bioavailability and the speed at which they can be titrated during anesthesia. Option B. Opioids are classified as sympathomimetic, parasympathomimetic, and anticholinergic, based on their effects on the autonomic nervous system, which influences their impact on cardiovascular stability during anesthesia. Option C. Opioids are classified as pure agonists, partial agonists, mixed agonist-antagonists, and pure antagonists, based on their affinity and intrinsic activity at mu, kappa, and delta opioid receptors, influencing their analgesic potency, efficacy, and potential for side effects. Option D. Opioids are classified as fast-acting, moderate-acting, and slow-acting, based on their onset of action after intravenous administration, which dictates their suitability for different surgical durations. Correct answer is C. Opioids are classified as pure agonists, partial agonists, mixed agonist-antagonists, and pure antagonists, based on their affinity and intrinsic activity at mu, kappa, and delta opioid receptors, influencing their analgesic potency, efficacy, and potential for side effects. Explanation. This scenario presents a professional challenge due to the critical nature of opioid selection and administration in veterinary anesthesia and analgesia, directly impacting patient safety and pain management outcomes. Veterinary technician specialist, VTS, in anesthesia and analgesia, must possess a comprehensive understanding of opioid pharmacology to make informed decisions that align with current best practices and regulatory guidelines. The challenge lies in accurately classifying opioids based on their receptor interactions and predicting their clinical effects, thereby ensuring appropriate drug selection for diverse patient populations and surgical procedures. The correct approach represents best professional practice because it demonstrates a thorough understanding of opioid classification and their mechanisms of action at the mu, kappa, and delta opioid receptors. This knowledge allows for the selection of agonists, partial agonists, or antagonists that best suit the patient's needs, minimizing adverse effects and maximizing analgesic efficacy. Adherence to the VTS anesthesia and analgesia regulatory framework, which emphasizes evidence-based practice and patient welfare, is paramount. This approach ensures that the VTS is making decisions based on scientific principles and established veterinary guidelines for pain management. An incorrect approach that fails to accurately classify opioids based on their receptor activity is professionally unacceptable. For instance, misidentifying a partial agonist as a full agonist could lead to inadequate analgesia, while treating a patient with a pure antagonist when an agonist is indicated would render the opioid ineffective. Such errors could result in patient suffering, increased risk of adverse events, and a failure to meet the standards of care expected of a VTS. These failures represent a breach of professional responsibility and potentially violate ethical guidelines that mandate competent practice and the provision of optimal patient care. The professional reasoning process for similar situations should involve a systematic evaluation of the patient's condition, the planned procedure, and the available pharmacological options. This includes recalling and applying knowledge of opioid receptor pharmacology, understanding the pharmacokinetic and pharmacodynamic profiles of different opioid classes, and considering potential drug interactions and contraindications. The VTS should consult relevant literature, institutional protocols, and collaborate with the supervising veterinarian to ensure the safest and most effective anesthetic and analgesic plan is implemented. This decision-making process prioritizes patient safety, ethical considerations, and adherence to the VTS anesthesia and analgesia scope of practice and regulatory requirements. Question 10. Regulatory review indicates that a veterinary technician specialist, VTS, in anesthesia and analgesia is managing a patient undergoing a lengthy surgical procedure requiring deep neuromuscular blockade. The VTS is tasked with ensuring safe and effective neuromuscular blockade and its subsequent reversal. Considering the VTS's advanced training and the need for objective patient assessment, which of the following approaches best aligns with current VTS standards of practice for monitoring neuromuscular blockade? Option A. Employing a quantitative neuromuscular monitoring device to assess the response to a specific nerve stimulus and guide decisions regarding reversal agents and extubation. Option B. Discontinuing neuromuscular monitoring once the surgical procedure is completed, assuming blockade has resolved. Option C. Relying on the absence of spontaneous movement and the return of palpable muscle twitches to determine the adequacy of neuromuscular blockade and recovery. Option D. Using a qualitative peripheral nerve stimulator and subjectively interpreting the degree of muscle twitch. The correct answer is C. Relying on the absence of spontaneous movement and the return of palpable muscle twitches to determine the adequacy of neuromuscular blockade and recovery. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of neuromuscular blockade monitoring in veterinary anesthesia. The veterinary technician specialist, VTS, must accurately interpret and respond to neuromuscular monitoring data to ensure patient safety, prevent prolonged recovery, and avoid potential complications such as residual neuromuscular blockade. The challenge lies in selecting the most appropriate monitoring technique based on the specific anesthetic agents used, the patient's condition, and the desired level of neuromuscular blockade, all while adhering to established veterinary standards of care and regulatory guidelines for VTS practice. Correct approach analysis. The correct approach involves utilizing a quantitative neuromuscular monitoring technique, such as acceleromeography or electromyography, to assess the degree of neuromuscular blockade. This method provides objective, real-time data on the response to a specific stimulus, e.g., train of force stimulation, allowing for precise determination of blockade intensity and the onset of recovery. This aligns with best professional practice by ensuring that decisions regarding reversal agents or continued ventilation are based on objective evidence, thereby minimizing the risk of residual neuromuscular blockade and its associated respiratory and motor deficits. This approach is supported by the VTS credentialing body's emphasis on evidence-based practice and the application of advanced monitoring techniques to optimize patient outcomes. Incorrect approaches analysis. One incorrect approach is relying solely on subjective clinical signs like the absence of spontaneous movement or the return of reflexes. While these may offer some indication, they are notoriously unreliable for accurately assessing the depth of neuromuscular blockade and the adequacy of recovery. This can lead to premature extubation or inadequate reversal, increasing the risk of respiratory depression and aspiration. This failure to employ objective monitoring directly contravenes the VTS standard of care, which mandates the use of advanced techniques for critical patient management. Another incorrect approach is to use a qualitative monitoring method, such as a peripheral nerve stimulator without quantitative output, and interpreting the response based on tactile or visual assessment of muscle twitch. While better than purely subjective signs, this method is still prone to observer variability and may not accurately reflect the degree of blockade at the diaphragm, which is crucial for spontaneous respiration. This falls short of the advanced, objective monitoring expected of a VTS. A further incorrect approach would be to discontinue monitoring once neuromuscular blockade is suspected to have resolved, without objective confirmation. This neglects the potential for delayed recovery or incomplete reversal, leaving the patient vulnerable to post-anesthetic complications. This demonstrates a lack of diligence and adherence to the principles of continuous patient assessment and risk mitigation. Professional reasoning. Professionals facing this situation should employ a decision-making framework that prioritizes patient safety and evidence-based practice. This involves 1. Assessing the anesthetic plan and the neuromuscular blocking agent used. 2. Identifying the most appropriate quantitative neuromuscular monitoring technique available and validated for veterinary use. 3. Establishing baseline measurements. 4. Continuously monitoring the neuromuscular response throughout the procedure and recovery. And 5. Using the objective data to guide decisions regarding the administration of reversal agents, the timing of extubation, and the need for continued ventilatory support. This systematic approach ensures that interventions are timely, appropriate, and based on objective physiological data, thereby upholding the highest standards of veterinary anesthesia and analgesia care. Question 11. Quality control measures reveal that a 15-year-old canine patient with pre-existing renal insufficiency and mild cardiac valvular disease is scheduled for a routine dental prophylaxis. The veterinary technician specialist, VTS, in anesthesia and analgesia is tasked with developing the anesthetic and analgesic plan. Which of the following approaches best reflects the VTS's specialized role and responsibilities in managing this high-risk patient? Option A. Postpone the procedure indefinitely due to the patient's age and comorbidities, recommending euthanasia as the only humane option. Option B. Administer a standard anesthetic protocol commonly used for healthy adult canines, focusing primarily on achieving adequate surgical plane of anesthesia and postoperative pain relief. Option C. Administer a mild sedative and analgesic prior to the procedure, assuming this will be sufficient to manage the patient's comfort and anesthetic needs without a full anesthetic protocol. Option D. Develop a customized anesthetic and analgesic plan that incorporates pre-anesthetic stabilization, judicious selection of anesthetic agents with minimal renal and cardiovascular impact, advanced physiological monitoring, and a multimodal approach to pain management, in consultation with the supervising veterinarian. The correct answer is B. Administer a standard anesthetic protocol commonly used for healthy adult canines, focusing primarily on achieving adequate surgical plane of anesthesia and postoperative pain relief. Explanation: this scenario presents a professional challenge because it requires the veterinary technician specialist, VTS, to balance the immediate need for surgical intervention with the inherent risks associated with a geriatric patient exhibiting pre-existing health conditions. The VTS must critically evaluate the patient's overall health status, not just the presenting surgical issue, to develop a safe and effective anesthetic and analgesic plan. This involves a deep understanding of how age-related physiological changes and comorbidities impact anesthetic drug pharmacokinetics and pharmacodynamics, as well as the patient's ability to tolerate stress and recover. The challenge lies in tailoring the plan to minimize risks while ensuring adequate pain management and surgical success, adhering to the highest standards of patient care, as mandated by the VTS credentialing body's ethical guidelines and scope of practice. The correct approach represents best professional practice because it prioritizes a comprehensive pre-anesthetic assessment and the development of a tailored anesthetic and analgesic plan. This aligns with the VTS's responsibility to provide advanced, specialized care. By consulting with the supervising veterinarian, reviewing diagnostic data, and considering all age and health-related factors, the VTS ensures that the chosen anesthetic agents, dosages, monitoring parameters, and pain management strategies are specifically chosen to mitigate the increased risks associated with this patient. This proactive, individualized approach is ethically sound and directly addresses the core competencies expected of a VTS in anesthesia and analgesia, aiming for the best possible patient outcome. An incorrect approach that involves proceeding with a standard anesthetic protocol without significant modification fails to acknowledge the heightened risks of a geriatric patient with comorbidities. This demonstrates a lack of critical thinking and a failure to apply specialized knowledge, potentially leading to adverse events such as prolonged recovery, cardiovascular compromise, or inadequate pain relief. Ethically, this approach breaches the duty of care by not adequately addressing the patient's specific vulnerabilities. Another incorrect approach, such as delaying the procedure indefinitely due to perceived risk without exploring mitigation strategies, might be professionally unacceptable if the underlying condition is progressive or life-threatening. While risk assessment is crucial, a VTS's role includes finding solutions, not just identifying problems. This approach could be seen as a failure to advocate for the patient's well-being when a safe, albeit carefully managed, intervention might be possible. A further incorrect approach, such as administering a sedative and analgesia without a comprehensive anesthetic plan, overlooks the systemic effects of these drugs in a compromised patient. This could lead to unexpected respiratory depression or cardiovascular instability, especially in a geriatric patient. It represents a failure to adhere to the systematic and thorough planning required for safe anesthesia and analgesia, particularly in high-risk cases. The professional decision-making process for similar situations should involve a systematic evaluation. 1. Thoroughly review the patient's signalment, history, and physical examination findings, paying close attention to age-related changes and any documented comorbidities. 2. Analyze available diagnostic data, blood work, imaging, EC, to assess organ function and identify potential anesthetic contraindications or risk factors. 3. Collaborate closely with the supervising veterinarian to discuss the patient's risk profile and potential anesthetic and analgesic options. 4. Develop a multimodal anesthetic and analgesic plan that accounts for the patient's specific vulnerabilities, including judicious selection of agents, appropriate dosages, advanced monitoring techniques, and aggressive pain management. 5. Continuously reassess the patient's status throughout the peri-anesthetic period and be prepared to adapt the plan as needed. Question 12. Compliance review shows a veterinary technician specialist, VTS, preparing to anesthetize a French bulldog for a routine dental prophylaxis. The VTS has a standard anesthetic protocol for dental procedures. Considering the breed's known predispositions, which of the following approaches demonstrates the most appropriate and safest anesthetic management strategy? Option A. Prioritizing a rapid induction to minimize the time the patient is exposed to anesthetic agents, even if it means slightly less emphasis on pre-anesthetic preparation. Option B. Consulting current veterinary anesthesia literature for breed-specific recommendations for brachycephalic breeds and modifying the standard protocol accordingly, including pre-oxygenation and careful airway management. Option C. Relying on personal experience with similar dental procedures in other breeds and proceeding with the standard protocol without further research. Option D. Administering a pre-anesthetic sedative and then proceeding with the standard induction and maintenance protocol, focusing on rapid intubation. The correct answer is D. Administering a pre-anesthetic sedative and then proceeding with the standard induction and maintenance protocol, focusing on rapid intubation. Explanation. This scenario presents a professional challenge due to the inherent variability in anesthetic responses across different breeds, particularly concerning brachycephalic breeds. The veterinarian technician specialist, VTS, must exercise careful judgment to anticipate and mitigate breed-specific risks, ensuring patient safety and adherence to established anesthetic protocols. The correct approach represents best professional practice because it prioritizes a thorough pre-anesthetic assessment tailored to the specific breed's known physiological predispositions. This aligns with the VTS's role in providing advanced anesthetic care and upholding the highest standards of patient welfare, as implicitly guided by the principles of responsible veterinary practice and the VTS credential's emphasis on specialized knowledge. Proactive identification of potential complications, such as airway obstruction in brachycephalic breeds, allows for the implementation of appropriate preventative measures and modifications to the anesthetic plan, thereby minimizing risks and optimizing patient outcomes. This proactive, breed-specific approach is a cornerstone of advanced veterinary anesthesia. An incorrect approach that focuses solely on a standardized anesthetic protocol without considering breed-specific factors fails to meet the expected standard of care for a VTS. This oversight could lead to delayed recognition of complications, increased anesthetic risk, and potentially adverse outcomes, which would be a deviation from the ethical obligation to provide competent and individualized patient care. Another incorrect approach that neglects to consult updated breed-specific anesthetic literature or guidelines demonstrates a failure to maintain current knowledge. VTS credential implies a commitment to ongoing learning and the application of evidence-based practices. Relying on outdated information or personal experience alone, without referencing current best practices for specific breeds, can lead to suboptimal anesthetic management and increased patient risk. This could be seen as a failure to uphold the professional standards expected of a specialist. A third incorrect approach that prioritizes speed of induction over patient safety, especially in breeds prone to respiratory compromise, is ethically unacceptable. Anesthesia is a high-risk procedure, and the VTS's primary responsibility is patient well-being. Rushing the induction process without adequate consideration for the patient's specific vulnerabilities, such as those common in brachycephalic breeds, directly contravenes the ethical imperative to prioritize patient safety and minimize harm. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough patient assessment, including breed-specific predispositions. 2. Review of current literature and guidelines relevant to the patient's breed and the planned procedure. 3. Development of a comprehensive anesthetic plan that addresses potential breed-specific risks. 4. Continuous intra-anesthetic monitoring and prompt intervention for any deviations from the expected course. 5. Post-anesthetic evaluation with breed-specific considerations. Question 13. Implementation of capnography monitoring reveals a sudden, significant decrease in end-tidal carbon dioxide ECO2 from 40 mmHg to 20 mmHg, accompanied by a flattening of the alveolar plateau on the waveform. The patient is intubated and mechanically ventilated. What is the most appropriate initial diagnostic and management approach for a veterinary technician specialist, VTS, in anesthesia and analgesia? Option A. Administer a bronchodilator and a positive inotropic agent to address potential bronchospasm and cardiac compromise. Option B. Assume a severe metabolic acidosis is developing and initiate bicarbonate therapy. Option C. Immediately increase the mechanical ventilation rate and tidal volume and administer a bolus of intravenous fluids. Option D. Assess the endotracheal tube for patency and secure placement. Check the capnograph sampling line for kinks or disconnections, and auscultate the patient's lungs for bilateral breath sounds. The correct answer is C. Immediately increase the mechanical ventilation rate and tidal volume and administer a bolus of intravenous fluids. Explanation. This scenario presents a common yet critical challenge in veterinary anesthesia, interpreting abnormal capnography readings, and responding appropriately to ensure patient safety. The professional challenge lies in distinguishing between a true physiological abnormality, requiring immediate intervention, and a technical artifact, while also considering the patient's overall clinical status. A VTS anesthesia and analgesia specialist must possess a deep understanding of respiratory physiology, anesthetic pharmacology, and the mechanics of capnography to make rapid, informed decisions. The ability to correlate capnographic waveforms with other vital signs and the patient's condition is paramount. The correct approach represents best professional practice because it prioritizes patient well-being through a systematic and evidence-based diagnostic process. It involves a multifaceted evaluation that considers the waveform morphology, the patient's clinical signs, and potential equipment malfunctions. This aligns with the ethical obligation to provide competent care and the regulatory expectation for veterinary professionals to maintain up-to-date knowledge and skills in areas of specialization. Specifically, the Veterinary Technician Specialist, VTS, credential signifies a commitment to advanced competency, which includes the proficient interpretation and application of advanced monitoring techniques like capnography. Adhering to established protocols for troubleshooting abnormal readings ensures that interventions are targeted and effective, minimizing risks to the patient. An incorrect approach that immediately assumes a severe physiological event without thorough investigation is professionally unacceptable. This could lead to unnecessary and potentially harmful interventions, such as aggressive ventilation adjustments or drug administration, when the issue might be a simple disconnected sensor or a kinked tube. This failure to systematically troubleshoot violates the principle of prudent patient care and could be construed as negligence. Another incorrect approach that dismisses the abnormal reading as a minor issue without further investigation is equally problematic. This overlooks potential life-threatening conditions that may be subtly indicated by capnography. Ignoring a significant change in end-tidal carbon dioxide echo2 or waveform shape can lead to delayed diagnosis and treatment of critical events like hypoventilation, hyperventilation, or even cardiovascular compromise, directly contravening the VTS standard of care and the ethical duty to monitor and protect the patient. The professional reasoning framework for such situations involves a hierarchical approach. 1. Observe and document. Note the specific abnormality in the capnograph waveform and echo2 value. 2. Correlate. Simultaneously assess other vital signs, heart rate, respiratory rate, blood pressure, SpO2, temperature, and the patient's physical condition, chest excursion, auscultation. 3. Troubleshoot systematically. Check connections. Ensure the capnograph sampling line is securely connected to the endotracheal tube and the monitor. B. Inspect the sampling line. Look for kinks, blockages, or leaks. C. Verify calibration. If applicable and feasible, check monitor calibration. D. Assess the breathing circuit. Examine for leaks, obstructions, or improper function. E. Consider patient factors. Evaluate if the patient's physiological state, e.g., metabolic acidosis, increased CO2 production, could explain the reading. 4. Formulate a differential diagnosis. Based on the waveform, echo2, and clinical findings, hypothesize the most likely cause. 5. Intervene appropriately. Implement targeted interventions based on the most probable diagnosis. 6. Reevaluate. Continuously monitor the capnograph and other vital signs to assess the effectiveness of interventions. This systematic process ensures that decisions are data-driven, patient-centered, and aligned with the highest standards of veterinary anesthesia and analgesia practice. Question 14. Cost-benefit analysis shows that using a combination of a less expensive injectable induction agent and a lower-flow volatile anesthetic gas could significantly reduce the per-procedure drug cost for routine elective surgeries. As a veterinary technician specialist in anesthesia and analgesia, you are tasked with developing anesthetic protocols for these cases. Considering the potential impact on patient safety, recovery, and analgesia, which of the following approaches best aligns with professional standards and ethical obligations? Option A. Focus solely on achieving the lowest possible drug expenditure per procedure, assuming that all anesthetic agents are interchangeable and that patient outcomes will not be significantly compromised by the choice of cheaper alternatives. Option B. Implement the proposed cost-saving measures by selecting the least expensive injectable induction agent and the lowest concentration of volatile anesthetic gas that appears to maintain surgical planes of anesthesia, regardless of potential side effects or recovery quality. Option C. Advocate for the use of a single, inexpensive injectable anesthetic agent for induction and maintenance, eliminating the need for volatile anesthetic gases to further reduce costs, even if this compromises the ability to finely control anesthetic depth and provide adequate analgesia. Option D. Develop protocols that prioritize patient physiological stability, adequate intraoperative and postoperative analgesia, and predictable recovery, even if it means utilizing more expensive anesthetic agents or combinations when indicated by patient factors and surgical requirements. The correct answer is D. Develop protocols that prioritize patient physiological stability, adequate intraoperative and postoperative analgesia, and predictable recovery, even if it means utilizing more expensive anesthetic agents or combinations when indicated by patient factors and surgical requirements. Explanation: this scenario presents a common challenge in veterinary anesthesia, balancing the desire for cost-effectiveness with the paramount need for patient safety and optimal anesthetic outcomes. The veterinarian's directive to prioritize less expensive anesthetic agents, while understandable from a business perspective, directly conflicts with the VTS's ethical and professional obligation to provide the highest standard of care. The VTS must critically evaluate the proposed cost-saving measures against established anesthetic principles and the specific physiological needs of the patient. The correct approach prioritizes patient well-being and adherence to best practices in anesthesia and analgesia. This involves a thorough assessment of the patient's condition, the surgical procedure, and the known pharmacodynamics and pharmacokinetics of various anesthetic agents. Selecting agents and protocols that offer predictable and controllable anesthetic depth, adequate analgesia, and minimal adverse effects, even if they are not the absolute cheapest, represents the highest standard of professional practice. This aligns with the core tenets of veterinary medicine, which emphasize the welfare of the animal. Furthermore, it upholds the VTS's commitment to evidence-based medicine and the responsible use of anesthetic drugs, ensuring that decisions are driven by patient needs rather than solely by economic considerations. An incorrect approach would be to blindly follow the veterinarian's directive without critical evaluation. This could lead to the selection of anesthetic agents that are less suitable for the specific patient or procedure, potentially resulting in increased risks, prolonged recovery, or inadequate pain management. For instance, choosing a volatile anesthetic agent with a narrow therapeutic index or one known to cause significant respiratory depression in a compromised patient simply because it is cheaper would be a significant ethical and professional failure. This disregards the VTS's expertise and the established guidelines for safe anesthetic practice. Another failure would be to compromise on essential monitoring or supportive care to reduce costs, as this directly jeopardizes patient safety and violates the principles of responsible veterinary anesthesia. Such actions could be construed as negligence and a breach of professional duty. The professional decision-making process in such a situation requires a clear understanding of the VTS's scope of practice and ethical responsibilities. The VTS should engage in open and professional communication with the veterinarian, presenting a reasoned argument for the preferred anesthetic protocol based on patient safety and efficacy. This involves articulating the risks associated with the proposed cost-saving measures and proposing alternative solutions that achieve both cost-effectiveness and optimal patient care. The VTS should be prepared to cite relevant literature, professional guidelines, and their own clinical experience to support their recommendations. Ultimately, the VTS must advocate for the patient's best interests, even when faced with financial pressures. Question 15. The assessment process reveals that a canine patient under general anesthesia for a dental procedure is exhibiting a consistent pulse oximetry reading of 88% SpO2, despite appearing clinically stable with pink mucous membranes, a strong peripheral pulse, and adequate respiratory effort. The capnograph is displaying a consistent ECHO-2 of 40 mmHg. What is the most appropriate immediate action for the veterinary technician specialist to take? Option A. Immediately increase the fraction of inspired oxygen, FiO2, and assess for potential causes of hypoxemia, correlating with other monitoring parameters and physical findings. Option B. Administer a bolus of a respiratory stimulant to improve oxygenation. Option C. Discontinue anesthetic monitoring and focus solely on the patient's physical appearance, as the SpO2 reading may be erroneous. Option D. Increase the anesthetic depth to ensure the patient remains immobile for the procedure, as the SpO2 reading may indicate insufficient anesthetic playing. The correct answer is A. Immediately increase the fraction of inspired oxygen, FiO2, and assess for potential causes of hypoxemia, correlating with other monitoring parameters and physical findings. Explanation. The assessment process reveals a common challenge in veterinary anesthesia: the reliance on a single monitoring modality without considering its inherent limitations. Pulse oximetry is a valuable tool for assessing oxygenation, but it is susceptible to various artifacts and physiological states that can lead to inaccurate readings. A veterinary technician specialist in anesthesia and analgesia must possess a deep understanding of these limitations to ensure patient safety and provide appropriate care. This scenario is professionally challenging because it requires the technician to move beyond simply observing a number on a screen and instead engage in critical thinking and clinical correlation. The correct approach represents best professional practice because it prioritizes patient well-being through comprehensive assessment and critical evaluation of monitoring data. By correlating pulse oximetry readings with other vital signs and clinical observations, the technician can identify potential discrepancies and intervene proactively. This aligns with the ethical and regulatory obligations of veterinary professionals to provide a high standard of care, which includes utilizing all available information to make informed decisions and ensuring patient safety during anesthesia. The veterinary technician specialist, VTS, credential signifies a higher level of expertise, demanding this level of critical analysis and proactive patient management. An incorrect approach that solely relies on pulse oximetry without considering other factors is professionally unacceptable due to potential patient harm. For instance, ignoring a low SpO2 reading because the patient appears stable clinically could lead to undetected hypoxemia and subsequent tissue damage or adverse outcomes. Conversely, overreacting to a falsely low reading could lead to unnecessary interventions, increasing anesthetic depth, or administering additional medications, which can also compromise patient stability. Failure to correlate pulse oximetry with other parameters, such as capnography, blood pressure, physical assessment, represents a failure to adhere to best practices in anesthetic monitoring and a potential breach of professional responsibility to provide competent care. This lack of comprehensive assessment could be viewed as a deviation from the expected standard of care for a VTS. The professional decision-making process for similar situations involves a systematic approach. 1. Recognize the primary monitoring data, e.g., SpO2. 2. Critically evaluate the data in the context of the patient's overall condition and anesthetic plan. 3. Correlate the data with other available monitoring parameters, e.g., capnography, blood pressure, temperature. 4. Perform a thorough physical assessment, e.g., mucous membrane color, capillary refill time, pulse quality, respiratory effort. 5. Identify potential causes for discrepancies or concerning readings. 6. Formulate a differential diagnosis for the observed findings. 7. Implement appropriate interventions based on the comprehensive assessment. 8. Continuously re-evaluate the patient's response to interventions. Question 16. The evaluation methodology shows that when managing a geriatric canine patient presenting for elective dental surgery, which of the following anesthetic management strategies best addresses the increased physiological risks associated with advanced age? Option A. Performing a thorough pre-anesthetic assessment including a complete blood count, serum biochemistry profile, electrocardiogram, and thoracic radiographs to identify potential comorbidities, followed by a balanced anesthetic protocol utilizing a low-dose opioid CRI, a benzodiazepine, and a dissociative agent for premedication, induction with a carefully titrated intravenous agent, and maintenance with sevoflurane, with continuous invasive blood pressure monitoring, capnography, and pulse oximetry. Option B. Using a high dose of a long-acting sedative for premedication to ensure prolonged sedation throughout the procedure, followed by induction with a high concentration of isoflurane gas. Option C. Administering a standard dose of a short-acting opioid and a benzodiazepine for premedication, followed by induction with propofol to effect and maintenance with isoflurane, with routine monitoring of heart rate, respiratory rate, and non-invasive blood pressure. Option D. Inducing anesthesia with ketamine and diazepam, followed by maintenance with halothane, and relying solely on intermittent auscultation of heart sounds and palpation of peripheral pulses for cardiovascular monitoring. Correct answer is C. administering a standard dose of a short-acting opioid and a benzodiazepine for premedication, followed by induction with propofol to effect and maintenance with isoflurane, with routine monitoring of heart rate, respiratory rate, and non-invasive blood pressure. Explanation: the evaluation methodology shows that managing geriatric anesthesia presents unique challenges due to age-related physiological changes. These include decreased organ reserve, altered drug metabolism and distribution, and increased susceptibility to anesthetic complications. A geriatric patient's cardiovascular, respiratory, renal, and hepatic systems are often compromised, requiring meticulous pre-anesthetic assessment, tailored anesthetic protocols, and vigilant intra-anesthetic monitoring. The professional challenge lies in balancing the need for adequate analgesia and anesthesia with the increased risk of adverse events, necessitating a proactive and individualized approach. The correct approach represents best professional practice by prioritizing a comprehensive pre-anesthetic evaluation, including thorough history, physical examination, and diagnostic workup, e.g., blood work, ECG, thoracic radiographs, to identify and address any underlying comorbidities. This allows for the selection of anesthetic agents and techniques that minimize cardiovascular and respiratory depression, optimize fluid therapy, and provide effective pain management. The use of balanced anesthesia, multimodal analgesia, and careful titration of drugs based on continuous monitoring of vital signs aligns with the ethical imperative to provide the highest standard of care and minimize patient suffering, as guided by the principles of veterinary ethics and the VTS anesthesia and analgesia scope of practice. An incorrect approach that relies solely on standard anesthetic protocols without considering the geriatric patient's specific vulnerabilities fails to meet the standard of care. This could lead to profound hypotension, hypoxemia, or delayed recovery, potentially violating the ethical duty to avoid unnecessary harm. Another incorrect approach might involve underestimating the need for pain management in older animals, which is ethically unacceptable as it neglects the patient's welfare and can exacerbate physiological stress. Furthermore, failing to adjust drug dosages based on altered pharmacokinetics in geriatric patients or neglecting to monitor vital signs closely constitutes a deviation from best practices and could be considered professional negligence. Professionals should employ a decision-making framework that begins with a thorough risk assessment of the individual patient, considering all age-related factors. This is followed by the development of a customized anesthetic plan that anticipates potential complications and includes contingency measures. Continuous intra-anesthetic monitoring and prompt intervention based on physiological parameters are crucial. Post-anesthetic care should also be tailored to the geriatric patient's needs, focusing on pain control, hydration, and monitoring for delayed recovery or complications. This systematic, patient-centered approach ensures that the anesthetic and analgesic management is both safe and effective. Question 17. Investigation of anesthetic protocols for a pregnant canine undergoing elective ovariohysterectomy, focusing on the stakeholder perspective of the veterinary technician specialist, requires careful consideration of which of the following approaches to ensure optimal maternal and fetal outcomes. Option A: relying primarily on the surgeon's visual cues to assess anesthetic depth and maternal well-being, with minimal independent monitoring by the veterinary technician specialist. Option B: proceeding with a standard anesthetic protocol commonly used for non-pregnant adult dogs, assuming the physiological changes of pregnancy will not significantly impact drug efficacy or safety. Option C: administering a balanced anesthetic protocol utilizing agents with established safety profiles in pregnant animals, employing multimodal analgesia, and diligently monitoring maternal and fetal vital signs throughout the procedure. Option D: utilizing a novel anesthetic agent that has shown promise in laboratory studies for its rapid induction and recovery, without specific investigation into its effects on pregnant canines. The correct answer is C: administering a balanced anesthetic protocol utilizing agents with established safety profiles in pregnant animals, employing multimodal analgesia, and diligently monitoring maternal and fetal vital signs throughout the procedure. Explanation: this scenario is professionally challenging due to the inherent risks associated with anesthetic management of pregnant animals. The veterinarian and veterinary technician specialist must balance the need for surgical intervention with the physiological changes of pregnancy, which can impact drug pharmacokinetics, pharmacodynamics, and maternal/fetal well-being. Careful judgment is required to select anesthetic agents and protocols that minimize risks to both the dam and the fetus, considering potential teratogenicity, uterotonic effects, and altered cardiovascular and respiratory function. The correct approach represents best professional practice by prioritizing a thorough pre-anesthetic assessment, including a detailed history, physical examination, and consideration of the gestational stage. It emphasizes the use of anesthetic agents with a known safety profile in pregnant animals, employing multimodal analgesia to reduce the required dose of anesthetic drugs, and implementing meticulous intra-anesthetic monitoring of both maternal and fetal vital signs. This approach aligns with the ethical obligation to provide the highest standard of care and adheres to the principles of responsible veterinary practice, aiming to minimize patient harm and optimize outcomes. An incorrect approach that involves administering a novel anesthetic agent without prior research into its safety in pregnant animals represents a significant ethical and professional failure. This action disregards the fundamental principle of do no harm and exposes the dam and fetus to unknown risks, potentially leading to adverse outcomes such as fetal demise, premature labor, or maternal complications. It violates the expectation of competence and due diligence expected of a veterinary professional. Another incorrect approach, such as proceeding with anesthesia without adequate monitoring of fetal heart rate or maternal blood pressure, demonstrates a lack of commitment to comprehensive patient care. This oversight can lead to delayed recognition of critical events, such as fetal distress or maternal hypoperfusion, thereby compromising the ability to intervene effectively and potentially leading to irreversible damage or loss of life. This failure to monitor adequately falls short of the expected standard of care. Finally, an incorrect approach that involves solely relying on the surgeon's assessment of anesthetic depth without independent verification by the veterinary technician specialist is a breakdown in professional collaboration and oversight. The veterinary technician specialist has a distinct role in anesthetic monitoring and should not defer critical decisions solely to another team member, especially when patient safety is at stake. This can lead to misjudgments in anesthetic depth, resulting in either inadequate anesthesia and patient awareness or excessive anesthesia and potential complications. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive patient assessment, including specific considerations for pregnancy. 2. Thorough literature review and consultation regarding anesthetic protocols for pregnant animals. 3. Selection of appropriate, well-documented anesthetic agents and techniques. 4. Implementation of robust, multi-parameter monitoring, including fetal assessment where feasible. 5. Continuous reassessment and adaptation of the anesthetic plan based on patient response. And 6. Clear communication and collaboration among all members of the veterinary team. Question 18. What factors determine the selection of anesthetic agents and supportive care strategies for a geriatric feline patient with chronic renal insufficiency undergoing a surgical procedure? Option A. Patient's age, degree of renal dysfunction, cardiovascular status, and the specific surgical procedure's requirements. Option B. The cost-effectiveness of available anesthetic drugs and the veterinarian's personal preference for certain agents. Option C. A standard anesthetic protocol for healthy adult cats with minor adjustments based on the patient's weight. Option D. The speed of anesthetic induction and recovery, prioritizing minimal time spent under anesthesia. The correct answer is A. Patient's age, degree of renal dysfunction, cardiovascular status, and the specific surgical procedure's requirements. Explanation. This scenario is professionally challenging because the anesthetic management of a geriatric feline patient with concurrent renal insufficiency requires a nuanced, individualized approach. The veterinarian and technician must balance the need for surgical intervention with the significant risks associated with compromised organ function, reduced physiological reserve, and potential drug accumulation. Careful judgment is required to select appropriate anesthetic agents, dosages, monitoring parameters, and supportive care to minimize morbidity and mortality. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the principles of responsible veterinary anesthesia as outlined by the veterinary technician specialist, VTS, Anesthesia and Analgesia certification standards. This involves a thorough pre-anesthetic assessment, including a detailed review of the patient's history, physical examination findings, and diagnostic results, e.g., blood work indicating renal function. It necessitates the selection of anesthetic protocols that minimize nephrotoxicity and are cleared or metabolized by alternative pathways, such as using agents with shorter half-lives or those that can be titrated to effect. Furthermore, it mandates vigilant intra-anesthetic monitoring of vital signs, including blood pressure, heart rate, respiratory rate, oxygen saturation, and end-tidal carbon dioxide, with a focus on maintaining adequate hydration and renal perfusion. Post-anesthetic care must also be tailored to support renal function and manage pain effectively. This comprehensive, patient-centered strategy aligns with the ethical obligation to provide the highest standard of care. An incorrect approach that solely focuses on the most cost-effective anesthetic protocol fails to meet professional standards. This approach disregards the increased risks associated with the geriatric and renally compromised patient, potentially leading to adverse drug reactions, prolonged recovery, or even organ damage. Ethically, it violates the duty to provide competent care tailored to the individual patient's needs. Another incorrect approach that relies on a standard anesthetic protocol for healthy adult cats is also professionally unacceptable. This demonstrates a lack of understanding of the physiological changes associated with aging and renal disease, which significantly alter drug pharmacokinetics and pharmacodynamics. Such an approach ignores the critical need for dose adjustments and agent selection based on the patient's specific condition, thereby increasing the risk of anesthetic complications and contravening the principles of safe anesthetic practice. A third incorrect approach that prioritizes rapid induction and recovery above all else, without considering the patient's underlying health status, is also flawed. While efficient anesthetic management is desirable, it should never compromise patient safety. In a geriatric, renally compromised patient, rapid changes in hemodynamics or inadequate monitoring during induction or recovery can have severe consequences. This approach neglects the careful titration and monitoring required to ensure stability throughout the anesthetic period. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's condition, the proposed procedure, and the available anesthetic options. This includes a thorough risk-benefit analysis for each anesthetic choice, consultation with colleagues if necessary, and clear communication with the owner regarding the risks and benefits. The VTS in Anesthesia and Analgesia is expected to apply advanced knowledge and skills to develop and implement anesthetic plans that are safe, effective, and ethically sound, always prioritizing the well-being of the patient. Question 19. When evaluating the pre-anesthetic laboratory results for a 7-year-old Labrador Retriever presenting for elective orthopedic surgery, you note a mild elevation in alanine aminotransferase ALT and a slightly decreased packed cell volume, PCV. The patient is otherwise bright, alert, and responsive, with normal vital signs and no palpable abnormalities on physical examination. Which of the following represents the most appropriate course of action for the veterinary technician specialist to recommend to the supervising veterinarian? Option A. Advise delaying anesthesia and initiating intravenous fluid therapy and liver protectants for several days to recheck the ALT and PCV. Option B. Immediately recommend a liver biopsy and a blood transfusion prior to proceeding with anesthesia due to the elevated ALT and decreased PCV. Option C. Inform the veterinarian that the elevated ALT and decreased PCV are likely insignificant and do not warrant any specific anesthetic modifications or further investigation. Option D. Recommend proceeding with the anesthetic plan as formulated, but with increased vigilance for signs of hepatic compromise and anemia during and after anesthesia, and consider a follow-up liver enzyme panel post-operatively. The correct answer is D. Recommend proceeding with the anesthetic plan as formulated, but with increased vigilance for signs of hepatic compromise and anemia during and after anesthesia, and consider a follow-up liver enzyme panel post-operatively. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to interpret a complex set of pre-anesthetic laboratory results in the context of a specific patient's condition and planned procedure. The challenge lies in identifying which abnormalities are clinically significant for anesthetic risk assessment and which might be incidental findings, necessitating a nuanced understanding of physiology, pharmacology, and the specific diagnostic tests. The decision-making process must prioritize patient safety while avoiding unnecessary delays or interventions. Correct approach analysis. The correct approach involves a comprehensive review of all provided laboratory values, correlating them with the patient's signalment, history, and physical examination findings. This approach represents best professional practice by adhering to the VTS anesthesia and analgesia scope of practice, which includes patient assessment and risk stratification. It aligns with ethical principles of beneficence and non-maleficence by proactively identifying potential anesthetic complications and informing the anesthetic plan to mitigate risks. Regulatory guidelines for veterinary practice emphasize the importance of thorough patient evaluation prior to anesthesia, and this approach directly fulfills that requirement. Incorrect approach is analysis. One incorrect approach is to focus solely on a single abnormal value without considering the overall clinical picture. This could lead to over- or undertreatment, potentially increasing anesthetic risk or causing unnecessary stress and expense to the client. Ethically, this fails to provide comprehensive patient care. Regulatory failure occurs by not conducting a complete and thorough pre-anesthetic assessment as expected. Another incorrect approach is to dismiss all abnormal values as insignificant without further investigation or consultation. This disregards potential underlying pathology that could significantly impact anesthetic tolerance and recovery. This approach violates the principle of non-maleficence and could lead to adverse patient outcomes, constituting a regulatory and ethical breach. A third incorrect approach is to immediately recommend delaying anesthesia for further, potentially invasive diagnostics without a clear justification based on the severity of the abnormalities and the patient's overall status. While caution is warranted, unnecessary delays can also be detrimental, especially in emergency situations or for patients whose condition may worsen with waiting. This approach may not be the most prudent or efficient use of resources and could be considered a failure in professional judgment and patient advocacy. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough review of all available patient data. This includes signalment, history, physical examination, and all laboratory results. The next step is to identify any values that fall outside the established reference ranges. For each abnormal value, the professional must consider its potential clinical significance in relation to the patient's overall condition and the planned anesthetic procedure. This involves understanding the physiological implications of the abnormality and how it might affect anesthetic drug metabolism, cardiovascular function, respiratory function, and recovery. Consultation with the supervising veterinarian is crucial when there is uncertainty or when significant abnormalities are identified. The goal is to develop a tailored anesthetic plan that addresses identified risks and ensures the highest level of patient safety. Question 20. Stakeholder feedback indicates a recurring concern regarding the consistency and appropriateness of anesthetic protocols selected for various surgical cases. A veterinary technician specialist observes that in some instances, a standardized, pre-written anesthetic protocol is applied to a wide range of patients undergoing different procedures, without significant individual patient assessment or modification. This practice is often justified by the perceived efficiency it offers. Considering the principles of responsible veterinary anesthesia and the ethical obligations to patient welfare, which of the following represents the most appropriate approach to anesthetic protocol selection in this scenario? Option A. Employ the most recently developed or technologically advanced anesthetic agents and equipment available, assuming they inherently provide superior patient care and outcomes. Option B. Develop anesthetic protocols that are tailored to the individual patient's signalment, physiological status, concurrent diseases, and the specific surgical procedure, following a thorough pre-anesthetic evaluation. Option C. Utilize a single, comprehensive anesthetic protocol that has been proven effective in the majority of cases, applying it consistently for all patients to ensure uniformity and efficiency. Option D. Select anesthetic protocols based on the personal experience and preference of the supervising veterinarian, prioritizing agents they are most familiar with, regardless of patient-specific factors. The correct answer is B. Develop anesthetic protocols that are tailored to the individual patient's signalment, physiological status, concurrent diseases, and the specific surgical procedure, following a thorough pre-anesthetic evaluation. Explanation. This scenario presents a common professional challenge in veterinary anesthesia, balancing the need for efficient patient care with the ethical and regulatory obligations to provide individualized treatment. The challenge lies in recognizing that a one-size-fits-all approach to anesthetic protocols is not only suboptimal for patient outcomes, but also potentially violates the principles of responsible veterinary practice as outlined by regulatory bodies. The core of the issue is the deviation from established best practices and the potential for compromised patient safety and welfare. The correct approach represents best professional practice because it prioritizes patient-specific assessment and protocol tailoring. This aligns with the fundamental ethical duty of care owed to each animal, requiring veterinary professionals to consider individual factors such as age, breed, physiological status, concurrent diseases, and the specific surgical procedure. Regulatory frameworks, while not always dictating exact drug dosages, implicitly require that anesthetic plans be developed with the patient's best interests at heart, which necessitates a thorough pre-anesthetic evaluation and a customized protocol. This approach ensures that the chosen anesthetic agents and techniques are the safest and most effective for that particular patient, minimizing risks and optimizing recovery. An incorrect approach that relies solely on a pre-established, generic protocol without individual patient assessment fails to meet the standard of care. This can lead to adverse events, such as prolonged recovery, cardiopulmonary compromise, or inadequate pain management, which could be attributed to the failure to account for patient-specific risk factors. Ethically, this constitutes a breach of the duty of care. From a regulatory perspective, while not a direct violation of a specific dosage law, it could be seen as practicing below the accepted standard of care, potentially leading to disciplinary action if patient harm occurs. Another incorrect approach that involves selecting a protocol based on the veterinarian's personal preference or convenience, rather than objective patient assessment, is also professionally unacceptable. This prioritizes the practitioner's ease over the patient's well-being and can lead to the use of suboptimal or even contraindicated anesthetic agents. This is a clear ethical failure and a deviation from professional responsibility. A further incorrect approach, such as defaulting to the most expensive or newest anesthetic agents without a clear clinical justification, also represents a failure in professional decision-making. While innovation is encouraged, the selection of anesthetic agents must be based on efficacy, safety, and appropriateness for the individual patient and procedure, not on cost or novelty alone. This can lead to unnecessary financial burden on the client and potentially expose the patient to risks associated with agents not ideally suited for their condition. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive pre-anesthetic assessment. Thoroughly evaluate the patient's history, physical examination findings, and any diagnostic test results. 2. Risk stratification. Identify any pre-existing conditions or factors that may increase anesthetic risk. 3. Protocol development. Based on the assessment, formulate an anesthetic protocol that includes appropriate premedication, induction agents, maintenance agents, analgesics, and supportive care. This protocol should be tailored to the specific patient and procedure. 4. Justification. Be prepared to articulate the rationale behind the chosen protocol, demonstrating how it addresses the patient's individual needs and minimizes risks. 5. Monitoring and adjustment. Continuously monitor the patient's vital signs and adjust the anesthetic plan as needed throughout the procedure.